Blood pressure is one of the most common reasons a driver walks out of a DOT physical without a certificate. Knowing the numbers before you walk in changes everything. The FMCSA puts blood pressure into 3 categories, and each one has a different outcome for your medical certificate. If your reading comes in below 140/90, you're generally looking at the standard 2-year certificate, assuming nothing else flags during the exam. Once you cross into stage 1, that's a systolic between 140 and 159, or a diastolic between 90 and 99, you can still get certified, but your certificate gets cut to 1 year instead of 2. The examiner will want to see you managing it before your next renewal. Stage 2 runs from 160 to 179 systolic, or 100 to 109 diastolic. At that level, the examiner can issue a temporary certificate, valid for 3 months. That window is there for you to get treatment and bring the numbers down. If you can demonstrate your pressure is controlled when you come back, you may qualify for certification at that point. Stage 3 is 180 systolic or higher, or 110 diastolic or higher. At that reading, the examiner is required to disqualify you from certification until the pressure comes down. That's not a permanent verdict. It's a hold until the situation is addressed. One thing drivers ask about often is white coat hypertension. That's when your blood pressure spikes in a clinical setting simply because of the stress of the appointment. It's real, and examiners know about it, but the reading taken at the exam is the one that counts. If you know you tend to run high in medical settings, give yourself extra time before the appointment. Skip the caffeine that morning and try to sit quietly before they take the reading. Some drivers track their pressure at home using a validated monitor, so they have a pattern to reference and can talk through it with their examiner. If you're already on blood pressure medication, that doesn't automatically disqualify you. What matters is whether the pressure is actually controlled and whether the medication causes any side effects that could affect your ability to drive safely. Managing blood pressure on the road is genuinely harder than it sounds. The schedule, the food options, the stress. Working with your own physician between physicals, staying consistent with any prescribed medications, and building some habits around hydration and movement when you can. These things add up over time. The practical takeaway here is simple. Get your blood pressure checked before your DOT physical, not the morning of. Give yourself time to address anything that's trending in the wrong direction. A little lead time protects your certificate and keeps you working.